I'm going to start.
Yep. All right. Well, hello, everyone, and thank you for being here today. My name is Ashley Mueller, and I will be moderating today's webinar. Delta Omega is a 100-year-old honorary society in public health with chapters all over, specifically at 130 schools and programs around the world with over 30,000 members. This year, Delta Omega is hosting a series of professional development webinars focused on graduating students and early career professionals. Today's webinar is Leveraging Multi-Generational Approaches for Professional Development in Public Health by the Beta Omega chapter at Drexel University. And the presenter is Dr. Tariem Burroughs. We anticipate this presentation should be about 25-30 minutes, and we will have some time at the end for your questions. So with that, I'd like to pass it over to Dr. Burroughs.
Great. Thank you so much, Ashley, and welcome everyone. Thank you so much for being here this afternoon and or morning, depending if you're on West Coast. And today we'll be talking about leveraging multi-generational approaches for professional development in public health. So I'm going to first start off with it's multi-generational. And in this case, I'm going to define it as not just multi-generational as an age, we're really talking about multi-generational experience. We have many of us that are working in the field of public health or for a school of public health. We see people of all ages and stages of their career entering our institutions to learn about public health, learn more about public health, and to strengthen their ability to be public health practitioners that are built for the changing times. So again, in this sense, for our presentation today, we'll be using multi-generational as experience instead of age. So today's objectives: understand how multi-generational lenses can enhance professional development in public health. And overview of this, we'll examine some learner profiles, engagement strategies, and practical networking tools. So we are an evolving field. As public health is, so our needs must also evolve with the field. We have people, there are emerging threats, as we have seen with even how we conceptualize public health, and even when it comes to jobs in public health. There are new introductions of technologies, especially when it comes to AI. I'm sure many of you have been to a lot of presentations and conferences and meetings that talk about AI. And there also are the policy shifts that make sure that we need to have adaptive learners that are ready to meet these challenges and are ready to pivot and change as new challenges arise. And professional development must meet learners where they are across diverse careers and stages. And that means that we cannot sit and continue with the same old professional development series that we normally have. However, there are some things when it comes to resumes, cover letters, etc. But we must also change that when it comes to difficult conversations or when it comes to general just job search, they must be able to change and look for different things. For example, federal jobs, there are not as many as there were in the past. So we must have our learners to be able to change and adapt and learn about new different sectors that may touch the field of public health. And as I said, experience over age. Um, we are defining generations based on professional experience, not age. And that's really important in this thing. We have new members that are coming in and out of the job market and the job field. We have people that have been doing public health forever and they may not have a degree in public health. I always say when you ask 5 people how they got into public health, you're going to get 5 completely different answers. And that's okay. That's one of the things that makes the field of public health great, because you have so much diversity in thought, you have so much diversity in experience, you have so much diversity and just general thinking. And for that, we want to remember to maintain this inclusivity about it as well. So we want to make sure that our discussions are framed in a way that everyone feels like they belong, that everyone feels like they have a stake in the field of public health, as we should all want to have a stake in the health and the well-being of others. So who are our learners? So we have undergraduates, they're curious, exploring options, limited fields of exposure. These are the ones that are just coming in bright-eyed, but we also understand that some of our undergrads aren't just coming straight out of high school. We have undergrads that are coming in, they could be on a GI Bill, they could be vets. We have undergrads who are just like, I'm just returning to education that and going to university because I didn't have the opportunity to go for in the past. So when we think of our undergrads, we have to really think of them not just by age while we're doing this presentation today, but by their real experience. And they have so much experience. And I would say to our grad students, well, they're also very curious, even though they may have that bachelor's degree. But also, our graduates are emerging professionals as well. Some of them may take a gap year between doing their master's in public health or a doctorate in public health, or we have students that are like, well, I'm doing a combined major, like a doctorate in medicine, or they're going to do a JD, get their become a lawyer, but they're also doing public health. So having that exposure to the field and making sure that we understand that people have different needs and different goals and expectations, and but also understanding that they also have different gaps in knowledge, and that's again what makes it great. And our programs need to be flexible as well as customizable and inclusive for these individuals. So we should really think about our undergrads, for example, learning from their real world stories because they are growing up in this very quickly changing world and they're experiencing things so differently, have so much to bring to the table. But as they're seasoned professionals, they can also benefit from these fresh ideas because of this new lens that these undergrads are bringing. Or there's ways that we can continue to encourage collaboration and curiosity across these groups to enrich these experiences. It's you're never too old to be curious. And if there's anything that you can learn from this presentation today, is that always continue to remain curious. So diversity of experience equals strength. So as we talk about this, we want to think about how differing levels of experience contribute to professional growth. We want to encourage storytelling and share challenges as teaching tools because each story, each experience that someone shares enriches our lives as well and our experiences. There may be some that we resonate with more than others, which is great. And there may be some that we may not resonate with, but that's okay too, because through those differences that we can see some of the gaps in our own knowledge or in our own experiences that we can help continue to think about and reconceptualize how we engaged in those experiences. Let's say it was an experience that we had in the community. It can be an experience in the classroom. Again, that's where the professional development comes in, those difficult conversations. So two examples that I'll be talking about today is our Coffee and Convo series, short for conversation, and our Public Health Spotlight series. We'll be starting off with our Coffee and Convo series. Our Coffee and Convo series has been running here at the Drexel Dornsife School of Public Health since 2019, and we generally hold these 2 to 3 times quarterly because we are still in the quarter system. These are regular formal conversations across experience levels. We call it Coffee and Convos because we used to do these a lot more in person, and we actually used to serve coffee. Right now, because the nature of engagement has changed. Many of these are held over Zoom or oftentimes hybrid. And when it is hybrid, we do actually have coffee because we want to keep to that name, but we also do encourage others to have coffee as well as they are with us through these meetings. And we see these as low barrier entry points for authentic dialogue and learning. Um, and generally, the people that we have come in for these conversations are those who are alums. It's a great way to do alumni engagement, or professionals that are in the field of public health and also thinking about what is a professional in public health. It's not, again, always that person with that master's or doctorate in public health, but it's those practitioners that have been in the field and doing the work for many, many years, or the ones that are just starting the work. We've also seen that there has been a great opportunity for recruitment when doing these coffee and convo series and learning about others and their career paths and the environments that they work in, or even the organizations that they work in. A great opportunity to answer questions. And when we have those individuals that are in the room, if that space is in person or virtual, new conversations arise, conversations that either someone that's just starting out or an undergrad or a master student or someone that just graduate that they didn't think about because they didn't need to think about based on where they are in life, but are happy to have heard the answer to that question or even the question itself being spoken. And so that dialogue, again, it really enriches all of us. And these real world experiences, you can see yourselves in these experiences as well. From the person that is 1 year out, 2 years out, 5 years out, or even 10 or 20 years out. And yes, we are really grateful to have some alums that have been out in the field for quite some time who want to come back and talk to the current students about their experiences and how they got there, or as well as practitioners. And again, another opportunity for career exploration. Like this is again a dynamic field that is constantly changing. So we can even have someone who comes in from Children's Hospital and talk about the role that they are doing, but they can come back 2 years later and say, "I'm doing this new role, still within Children's Hospital, but the job that I'm doing is very different," and that's cool. Second one we're going to talk about is our Population Health Spotlight series. So this one is hosted biannually, and it's held 4 or 5 times biannually. So this current series is on infectious disease prevention and prediction and perspectives. Unlike our Coffee and Convo series, this is more our population health series is more thematic. Last year, our series was about health equity and LGBT health, and as well as I said, this year is about infectious disease. Each event supports one credit hour towards National Board of Public Health Examiners, or the NBPHE, and Certified in Public Health CPH Continuing Education credit. Unlike our Coffee and Convo series, this speaks to a larger and diverse base as well. So it could be that student that I want to see this amazing speaker come in and tell their work in this particular area, but I can also be an alum or I can be another practitioner in the field, and I can get credit for this, but I also engage and also recruit. I can showcase this innovative public health research and practice, but I can also ask questions. Really, one thing that we always try to emphasize is that you're not always going to have these individuals in the room. And these individuals that we speak of are dynamic and they are amazing and have so much to share. So we always encourage from those who are starting out, undergrad, masters, alum, whoever, to always ask questions. Ask about the work that they're doing in a local level or national level or the global level. Ask how they're improving population health. That's how the field is changing. That's their job and their career. Really can encouraging to kind of take advantage of this. Focus on also focus on their story. Again, these stories are so important, and there's so much to learn from it. Not just that this person did a paper on X or Y, but how did they get to that point? How did they move up? Who did they engage with? Who did they network with? Who are their colleagues? And so all the things that may not be as prevalent on the front end, but are just as important to you as the person that's sitting in the room that is currently in the field or looking to change within the field, and how much you can get from that. And then the great thing about both of these opportunities, it's time to talk to the person afterwards. Sometimes for the population health spotlight series, it may be a little harder because many people want to talk at once. But 9 times out of 10, the person that comes in and speak, and this also goes for the coffee and convo series, that they're more than happy to talk. They are more than happy to network and dialogue or learn more about you. Again, each opportunity for networking or just job thinking or career paths is going to be very powerful and important. So, designing for inclusion and building real communities. We know that not all communities, especially now, have to be in person, and that's okay. But they're in person, that's great. But these online communities are just as important. We have bases such as LinkedIn, or here at Drexel, we also have a Dragon Network, or we have Handshake, ways for people to engage and share jobs and information. But at the heart of it, we want to, make events that work for everyone. We have so many different learners who want so many different things from this. And I know oftentimes we say we can't be everything to everyone. However, we could build something that everyone is it's interested in to coming to, that kind of cuts across these generations. And those things that cut across the generation is networking, engagement, job search, learning, careers, and just belonging together. So we want to make sure the objectives of each of these events are clear, that the formats are diverse, they're accessible. Again, if individuals were more accustomed to in person or online or even hybrid, yes, we sometimes do hybrid as well. Whatever works. We want to make sure that everyone has the ability to engage how they would like to engage and would like to want to engage. We encourage participation by validating all perspectives. By validating all perspectives, that helps us grow through this conflict if something arises, helping engage in that conversation and knowing how to engage in that conversation at the moment is really an important thing. Or seeing others and how they engage when a perspective that is different or not like their own, not their own, and how someone handles that. Again, so much covert learning is happening through these engagements. And again, beyond networking is fostering belonging, importance of trust, respect, and community building. It's one thing that we always lay the foundation for when we enter and start these meetings, that we have all come here to learn and respect that space and respect one another. Even though we may have different perspectives, we all have something to contribute to this space. And using those feedback loops and shared leadership program design, one important thing that we use here at Drexel is that feedback loop. It's so important, even selecting what speakers or the type of speakers that we would like to bring in. Thinking back to our coffee and convo series, making sure that we have enough sectors represented. If it is government, or if it's academic, or if it's someone that works in food insecurity, or someone that works in mental health, making sure that we are keeping abreast of the moment in time. We also have some dynamic speakers that come back every year, and that's really great. Making sure that we continue to foster those relationships, taking into account that these are interesting points and interesting people, interesting work, and these are organizations that are on the move. They are growing, they are tackling new issues, but also really thinking about old issues and growth in these particular areas. And then we have career explanation through advancement through networking, integrating networking into academia. It's a learning tool, not just a job hunt. It's not just getting from point A to point B. Uh, for example, of just applying to the job and getting a job, but also knowing that this is a career that we are entering, or the career that some of us are in, and making sure that we continue to grow in this career. And so, really seeing this as learning tools, the more that you go to, the more things that you learn, the more people that you meet, the more things you unlearn as well. And we have to remember that that unlearning process is just as important, because we come in with and many of our students as well, kind of misconceptions and preconceptions of how this area should be, or how this is actually done. And we oftentimes say it's like, no, it's not always like that. It can change. And 9 times out of 10, it will change. And that's okay. You have to be able to understand and be able to move with those changes. Um, so using class assignments to stimulate professional connections, we ourselves also hold a professional development series that we have all of our students also complete before they engage in their applied practical experience, so they can have some of those hand-on techniques and skills for when they are engaging in these spaces for the coffee and convos or the public health spotlight series. We also empower career transitioners. Again, not everyone is in school. Some people are just moving through school, and leveraging experience in these fields, acknowledging the strengths of transitioners, and also seeing that you may not be working in this job for 20 years, and that's okay. You may be working this job for 2 years because you either A, didn't want to do the work that you're doing. B, you saw a new opportunity, and or you want to see something for growth. You want to be a leader. We want to really think about how they think how systems work and how one can navigate and float through systems as well, and how they can be rebuilt. How learning some entrepreneurship, how the systems can be fixed from the inside, and offer tailored mentorship. That's a really important aspect of this as well. There are mentorship opportunities, and the way that you find mentorship opportunities is actually finding people and learning from others and learning from their experiences and what they do, being exposed. There's so many amazing things that are happening in the field of public health, or when we talk to our students or either transitioners or career transitioners about social determinants of health and what goes into social determinants of health, it really starts to vary, or even how we think of what is a social determinant of health. You know, we have the standard definitions, but when you're out in a field and you're asking Joe, somebody on the street, what is a social determinant of health, they may not know the answer. And also keeping abreast that when we think about the real world, we're not just talking on the local or domestic level, we're also talking about on a global scale as well. We usually have once or twice a year someone from the global sector as well. Those conversations are so amazing and so rich because they bring up so many so many things that we generally don't think about on a domestic level. Oftentimes those conversations they may hit lulls of quiet points, but that's okay because some issues that are brought up or some descriptions of different programs we haven't thought about yet because we haven't generally had to think about them on a domestic level. So some quick recaps on what we learned. So multi-generational, again, multi-generational as we think about generations as they exist on the level of um, experience, not just age, and approaches to create richer and more inclusive professional developments, developments that one wants to continue to learn, one that, and also with the little bit of perk of getting those credits as well. The learners benefit from intentional pollination of ideas and experience. And if we think about it, that's how jobs work when you are in the field and you're learning from that practitioner that's been there for 20 years and a practitioner that's been there for 5 years, but also thinking of someone who has been in the field themselves for many years, I learn so much from my students. Excuse me, in the way they think, the way they reconceptualize some of these issues and some of their ideas are at first, it could be a little jarring, but when I sit back and think about it, it's like, you're right. I never thought about it like that. I never thought that you can use this infographic in this way. I never thought how you can use TikTok. I myself am not a TikTok aficionado, but I have seen people use it, or even thinking about how you can use WhatsApp to reach more populations, immigrant populations, for example. And so it doesn't have to be this giant thing. You can start small. Just host a dialogue or a meeting. You can work with student groups. They're also great advocates when it comes to starting these dialogues. Many of these dialogues may happen in those spheres already, but when you're trying to reach a larger body, we want to think about it's a great way to strategize to really think about. In our many of our organizations and schools, that we may not have always the bandwidth to do everything, but how we can work with each other to do that and mentor a newcomer. You at some point in your career were that newcomer. You may not have a traditional mentor, but there was somebody, if you think back, that really helped you start off and started you on your journey. And so really like playing that forward and sharing your journey with someone else and like how they can get more into the field and learning more and how to adapt to these changes. And consider how your institution or organization can incorporate these ideas. Again, start small. It could be with one department, it could be with one person. But if you find a means to start, 9 times out of 10, you reach out to individuals and they want to come back and talk more. I think about as we have been going forward with our summer institute, which work with our high school students, we have a lot of our alums as well as our partners that do want to give back. And they may not have all the time in the world, but they can donate a half an hour or an hour. And that's again just a start to something really big because if you can just touch one person, you can have one conversation, even if it's over coffee, even better, or if it's over a donut, or if it's online. If you can just have that one conversation, it can really spring so much more, and it can really start an amazing relationship, a relationship that not only the school can benefit from or that organization can benefit from, but you can benefit from and that other person can benefit from. So in that time, and if you have any questions, here's my info. Thank you.
Okay, well, thank you so much. If you do have any questions, you can put them in the Q&A section, and we will be answering those right now. Give it about another minute.
Mm-hmm.